Hi, everyone. I'm so excited to have a co host with me, my esteemed colleague, Dr. Tomassian. You may have been seeing him online giving all sorts of skincare advice, as well as having some major moves. Okay. I don't know anyone who can dance better than this guy.
She speaks too highly of
I
me.
mean, the rhythm, like, how do you stay on beat so well?
Multiple takes. A lot of takes.
Well, you make it look so easy and natural. I love it. We both love creating content on social, so I thought it would be so fun to have him as a co host today. So, welcome. Welcome to the show. I'm so excited you're here.
Thank you for having me. Excited to dive in.
I thought you would be the perfect co host because you are more than just a pretty face, right?
I appreciate I'll take the pretty face compliment.
So, Dr. Tomassian completed his medical school at the University of Missouri, Kansas City, and his dermatology training at Kansas University Medical Center, where he was named cosmetic chief of his residency program. We're both board certified dermatologists, and we both have practices in California. Tell us, where is your practice? Tell us a little bit about your practice.
So my practice is located in Glendora, California. So that's suburbs east of Pasadena. I specialize in all aspects of dermatology, surgical, cosmetic, medical. So see it all, treat it all kind of practice, which I love to do because it keeps it interesting for sure.
Yeah, I love that too. I think that's what's nice about dermatology is we can do, such a wide spectrum of services. It keeps it really interesting and fun.
Yeah.
Chris, normally we do a beauty and blemish with my co-host. So because you're my host today, what do you have a beauty which is like the best part of your life and then a blemish which is the not so great part that you wish you could take a little concealer and just kind of or a little benzoyl peroxide spot treatment
Or
on it
a little beauty filter on
or a
it.
little beauty filter?
I would say the beauty of my life right now is planning my destination wedding
Woohoo.
next year in Miami. The blemish is also planning the wedding because there's way too many decisions to make. I don't understand flowers. I don't understand any of the stuff I need to do. So
It's a lot.
thankfully, I have a great fiance who deals with most of it.
You do. Yeah, your fiance is really the
What about
best. I
you?
mean,
What's your beauty and blemish?
my blemishes, well, I just had a really intense Friday. So I just, the clinic was just packed and, just trying to accommodate everyone. It can get really overwhelming, especially on a Friday. But my beauty is that you're on the podcast today and we're going to the Masters of Aesthetics, which I'm giving a lecture on tomorrow. So I'm excited about that. That would be my beauty and my blemish. Now back to you because I'm going to put you on the hot
Oh,
spot
I'm ready.
today,
I'm
okay?
ready.
So you're getting married. I'm so excited for you. We always talk about what women should do, up as a wedding prep, right? But I never hear people talk about men. Like what should men do 6 months before their wedding, a year before their wedding? Let's talk a little bit about men's wedding prep.
That is a great question. And honestly, I see a lot of women before their wedding,
Yes.
and then the man will come with her
But only because the
only
women
because. And then I start just talking to them and
yeah.
saying, they're like, oh, I don't need to do anything. But you do need to do stuff for your wedding, okay? It's also about you. So usually I say it all starts, like you said, about a year out. If you're planned a year out for your wedding. If it's a quicker wedding, we got to speed up the process a little bit. But you start off with a great skincare routine. You should be doing sunscreen all the time. You need to be doing your retinol, your vitamin C, even out your skin texture, even out any of the dark spots. And then I like to incorporate a little bit of procedures. And I actually like to incorporate them early on because you don't want to do any procedures for the first time right before a
That's
wedding.
true, yeah.
You know?
Yeah.
So adding in a little bit of a Botox or Dysport or some type of neuromodulator to soften the wrinkles. You don't want to get rid of everything because you've been very accustomed to your face. You want to just soften it and just make it really, I would say, youthful and refreshed.
Right. And our approach is different with Botox in males versus females,
Mm-hmm.
right? So there's definitely a way we can still keep your ruggedness and your masculinity.
Exactly. And then, I add in, depending on what they have, if they have dark spots, I like to add in a photofacial, something with IPL, depending on their skin type, radio frequency microneedling, something to tighten the skin. I have a CO2 laser in my clinic, so I have a very low setting. It's almost just like a nice refreshing peel. So you could actually do that every month for about 3 or 4 times before the wedding, and it just gives you a nice, even skin texture and just a very low downtime. So
I love that. Light and gentle, but do a few of them, right?
yeah.
And you'll have some new, fresh skin coming in for the wedding.
And then sleep. That's a big one, because if you don't
Yeah.
sleep, you are going to have very tired under eyes.
Yes, you need your beauty rest.
Exactly.
What about like the week before, 2 weeks before? Is there anything you have them do or no? Just lay low and sleep.
Honestly, a week or two before, the less is more. If you start adding in things, God forbid you have a reaction, something goes wrong with a procedure. This is one of the big ones with Botox. Someone who comes in the first time for Botox or some type of neuromodulator and they've never had it before, and you don't have that time to fix it if you need to. So less is more for the last 2 weeks. A lot of sunscreen. Don't get crazy. Go get sunburned right before your wedding. You don't want to do that. We've seen videos like that all the time. So
that's true. You don't want to show up at your wedding with a sunburn in Miami, especially.
Exactly.
So I love that. Well, moving on, I know that you just opened a practice about a year or so ago. I have a lot of toys. I want to hear about your toys. What kind of toys do you have in your practice?
I don't think there's a comparison. You have like the Ferraris, the Lamborghinis of lasers.
I'm just a little older than you. I've been in practice a little longer, but that's
your
okay.
garage is like what the MTV Cribs garage with your lasers, So at my practice, actually, after talking to you, when I opened mine, you gave me a lot of guidance, and I have a CO2 laser, I have an IPL, I have a KTP for blood vessels, those little stubborn ones around the nose. I have a radio frequency microneedling, regular microneedling, and just added on a Fraxel laser as well.
Oh, nice. I love the Fraxel.
Yeah.
I had the Fraxel before I got the Halo, but the Fraxel is a classic. You can do so much with that.
Yeah, especially my patient population's a lot of darker skins, Middle Easterns, and I can't be too aggressive with my ablative laser, so I have to use something a little bit more gentle, but still give a great result.
Yeah, I love the variety. I think you can do probably 99% of things. That.
Do you have a favorite toy yourself?
Oh, that's so hard. I love my resurfacing, so I do have a CO2 and a Profractional, which is erbium, and Halo, so I love those. Those are really fun.
Your videos with that close-up tightening when you do your laser resurfacing.
It's so fun to see. It's my favorite.
I love those videos.
I know. People love the pimple popping, but my go-to is seeing that skin tighten. So I thought it would be fun, doing a little discussion about how we would approach patients that come in. I mean, we see these people every day come into our office asking for, different cosmetic concern, and I'd love to hear your take. Starting with the cosmetic consult. I mean, do you get people that call and they're like, how much is your BBL or how much is your IPL? Because I want to schedule a treatment. I mean, what do you say to that?
So many times. And, the cosmetic market is filled with advertising, right? So people are seeing these procedures or these names of procedures, and they'll call and just be like, oh, I want that, because they see the before and afters, but they don't really understand what the device is doing, what it's really for. And I think that's what makes the cosmetic consult so important. Like you said, people call and they're like, I want a CO2 laser, and I'm like looking at their picture, and I'm like, you
definitely don't want a CO2
You don't want a CO2. I'll burn your skin. It's not going to be great for you. So having that consult, one, it makes it way more tailored of an approach. As you know, with cosmetics, nothing's one and done.
That's right.
Everything's building a journey with cosmetics to get you to that result that's very natural. We're not changing anything. We're just giving you that nice, refreshed look. And you don't want to cookie cutter it. And I feel like sometimes people assume it is cookie cutter when they call and they're like, how much is this? I want to pay for this. And it's not really like that.
Agreed. Yeah, I think more people need to understand that. It's so important to have that cosmetic evaluation.
Yeah. And I know you do a lot of under eyes, and I think that's a big one. That
is a big one, because people think, oh, I have dark circles, I need filler. Not necessarily, because we've also seen fillers make dark circles worse.
100%.
So I love that. Well, let's run through some scenarios. First one being you have this beautiful 35-year-old that comes in and she has acne scarring and she's been dealing with it for so many years. What is your approach? How do you approach someone with acne scars on their cheeks, their temples?
Great question. That's probably one of the most common reasons I see my younger patients for
Mm-hmm.
cosmetics, actually. I would say first I look at their skin. If they still have really bad active acne,
Mm-hmm.
we got to get that controlled first.
Absolutely.
But if they're, acne's all gone and they just have scarring, it really, one, depends on the type of skin they have, how dark or light their skin is, and that means how aggressive I could be. So I look at scarring in a multitude of ways. So one is skincare. You want to do your skincare right. So you want to add in collagen boosting ingredients, right? Vitamin C, exfoliants like lactic or glycolic acid, retinol. But you need to do the procedures because these things are tethered down.
Mm-hmm.
Scars are tethered down. So one way is subcision. And I know you love this.
I do. I love subcision.
So subcision is basically putting that needle under the skin and actually breaking down those tethers that make that indentation. And that allows all the other procedures we do to really have a much more dramatic effect. So for me, I love microneedling. I love radiofrequency microneedling, especially on the bipolar mode. And then, of course, for me, I like the CO2 laser for resurfacing, getting deep on that. It's one of the best treatments I think I have because one good treatment gives someone dramatic improvement to the point where, their scars might not be all gone, but they think it's night and day difference.
Significantly better.
Night and day difference. So I love that in my clinic.
Yeah, and just, giving somebody that confidence back is so important and so fulfilling. I know for me, it really is one of my favorites to see them come back.
Do you do anything different? Do you add in?
So that's great. I love that approach. And I always do start with subcision because I think releasing that tethering is important, especially if you're going to do a laser. But sometimes I think just adding a little bit of filler, honestly, just in some of the kind of deeper, wider atrophic scars makes a huge difference. And that's sometimes easy to do. If somebody doesn't have the downtime for the subcision and the CO2s and they just have, some noticeable, depressed scars, just adding, and I like to add it really superficial, and using a product like Restylane, I think makes a big difference.
Yeah.
But RF
definitely.
microneedling, you have that, and that's great for if you've got darker skin tones. It's not as, dramatic or as intense as the CO2, but for darker skin, I think that's great.
Yeah, I love it for darker skin types and low downtime, which is great.
Absolutely. Okay, we're going to move on down to the neck. I know I have a lot of people that come in that are bothered by lines and laxity, loose skin on their neck. And what is your approach? What would you do? What would you start with, or how would you approach that patient?
That's a great question. I think a lot of people do come in and they just pull their neck skin back and they're like, this is what I want. And I go,
you're in the wrong office.
I said, me too. That's what I want to give you. But I like to really start with radiofrequency microneedling for that. I like heat-based devices.
Yes.
If you can get the CO2 on a more superficial plane, I think it does help tighten as well in the neck. You have to be very careful there.
Yeah, we can't go as aggressive on the neck as we do on the face because there's not as many. It doesn't have as great of a regenerative power, right?
100%. But I love radiofrequency microneedling for this. Hyperdilute Radiesse as well as Sculptra you could do in that area just to help tighten the skin, build that collagen.
I'm afraid to do Sculptra on the neck. I haven't really done it. My go-to is Hyperdilute Radiesse. And I saw a lady this past week, actually, that came to me that had Sculptra done by someone else, actually a great doctor, a very well-known dermatologist, and she had developed these nodules.
Oh, wow.
And she didn't realize it was from the Sculptra, so they thought that she had some sort of lymphoma because it was like years later. And so she had these what felt like lymph nodes that were enlarged in her neck, and it was from Sculptra, a year or two before. And so she had them cut out, and then once they biopsied, the histology showed Sculptra granules.
Wow.
So I don't know. I mean, I guess any any complication is possible with any of these injectables. And you have to be careful with all of them. So that's why it's so important to see a board certified dermatologist,
100%.
because if you do happen to have, any sort of complication, even in the best of hands, I think you have to be really cautious with the neck. But yeah, I love the hyperdilute radius. I do that.
How much do you dilute it typically?
Usually 3 to 1.
3 to 1.
And you know what? I've also been adding a little bit of HA
Mm-hmm.
because calcium hydroxyapatite is so dense and so hard. I think it softens it up a little bit. So the way I see the mechanism of action is it's almost like it creates a scaffold in the skin. And then using that little HA as sort of a cushion in between the scaffold helps, draw and boost collagen and allow the collagen to lay down on the scaffold. But I find you have to do probably at least 3 sessions to see really good results.
I think
How about you?
For the radius,
Mhm.
usually I go even more sometimes.
Yeah,
for
I think you could go even more.
Yeah.
4 or 5. You're definitely safer the more.
I've realized in cosmetics, it's better to do more treatments than
That's
to
right.
be a little too aggressive and then have to deal with the complication after.
Agreed. That's a great motto to
You
live
know,
by. Yeah.
and I think when you have that comfort, and that's what makes the consult so important.
Yes. You can always bring them back.
You could always bring them back.
Yeah, and do more, but you can't. Sometimes it's hard to take it away.
Yeah.
So I love that. What about Botox on the neck? Is that something you do as well?
I don't really do it other than platysmal bands.
Mm-hmm.
I know a lot of people Botox around the neck
Mhm.
for those horizontal lines, and I've seen pretty good improvement with it. Most of my patients, I see better result with my devices than with the Botox.
Yeah, and it's expensive because you have to inject,
lot.
so many units that sometimes the result you get is a little bit more subtle than some of
But
the
definitely
lasers.
platysmal
Yeah, that
bands
makes a
does
huge difference.
yeah.
And I think it does help long term, like avoiding that pull, on
Yeah.
the lower face. So, well, I love this. This is so good. Okay, last scenario. I know you said you see a lot of patients with darker skin, and you and I being, Middle Eastern, a little bit more darker skin. What is your approach to somebody with hyperpigmentation, dark spots, and they have darker skin? So sometimes I know lasers, I'm not as hesitant to go to first. What's your approach to someone like that?
So this is actually funny because a lot of times I talk to patients who are
Mhm.
Middle Eastern or darker skin types, Asian skin,
Mm-hmm.
and I don't have a tan at all when I'm in the clinic. And I'm like, I get dark spots, and they look at me like, "What do you mean?" And I'm like, "No, trust me, I do get dark
Yeah,
spots."
you don't have a single dark spot.
I
I mean, you
do.
don't have a single
I do.
wrinkle, a single pore, a single
I
dark
do.
spot.
But usually I love to start with a good skincare routine for this. And I usually compound, a high strength hydroquinone with tretinoin,
Mhm.
kojic acid, niacinamide. And
Yeah.
I do it for 2 to 3 months and then give it a nice break from that. But that really just helps calm everything down.
Mm-hmm.
And then after that, I still do add in procedures. I do microneedling, even radiofrequency microneedling. It's not amazing for pigment, but it does help exfoliate the skin and help push it out a little bit.
Mm-hmm.
Fraxel's great for this, and a little bit
Yeah.
safer.
Yeah, low energy Fraxel. I love that.
Um,
We see that all the time.
And I know now there are better lasers. I don't have them in my clinic, but like Pico laser, and these
Yeah.
are a little bit
They're
safer
milder,
options.
yeah, safer. Mm-hmm.
What about you? Do you have
But honestly, just good old microneedling and really good skincare. So we haven't really talked a lot about skincare. So what would you be your top 3,
Ooh,
skincare
okay.
products or ingredients that you would use for hyperpigmentation?
Is this over the counter or prescription?
Let's do both.
Okay.
We could start with over the counter.
Over the counter,
Then you get the biggest bang for your buck, I guess.
I would say for sure retinol because it just adds so much benefit to the skin in general.
Mm-hmm. And it, reduces tyrosinase.
Yeah.
So it does help with pigmentation.
I like niacinamide for this. It is the jack of all traits, but I do think it also helps inhibit that pathway.
Mm-hmm.
I want to say vitamin C, but if you're having top 3,
I know. That's a tough question.
I would say maybe even tranexamic acid.
Yeah. Yeah.
Topical tranexamic acid. I've seen pretty good improvement with that
Yeah. You didn't say sunscreen.
one.
Everyone knows that already, aside from sunscreen.
We're I
We're
have
beyond that.
your knowledge of a sunscreen. I went above it.
Okay, fair enough, fair enough. What about prescription?
I really like Cispera. I like
Yes,
hydroquinone if done correctly.
yes. I
I
know
think
hydroquinone gets a bad rep, but you know what? If you use it the right way, under the guidance of your dermatologist, it can really be one of the most effective ingredients.
game changer.
Mm-hmm.
It is a game changer.
Yeah,
Those are probably my two
yeah.
favorite, but
I love that.
did I miss any?
No, I think that's good. I would agree with you on that. Back to your procedures, I think microneedling is probably one of the safest. You know, even RF microneedling is one of the safest for hyperpigmentation, dark skin. What about peels? We didn't really touch on peels. Is that something you incorporate into your practice, or do you have a favorite peel you like to do?
So initially, I didn't really incorporate many peels into my practice, but actually recently I just started,
Mm-hmm.
and I incorporating the VI peel.
Yeah,
So
that's
that one's
popular.
been very popular, safe in darker skin types too,
Mm-hmm, mm-hmm.
which I think is a great in terms of just like the price point of a peel. You get a
Yes,
good bang for your buck.
you do.
It's safe. The downtime is, I would say, similar to like a heavy microneedling. You
Right.
know, like
You
when
just
if
get peely.
you get peely,
In worst
um,
case scenario, you look like a lizard that's just shedding,
and people will ask you
shedding
what you did, and
skin.
be like, just wait a couple more ways, and you'll see the fresh skin
Hang on.
underneath.
I'll be right there in 2 weeks.
That's probably the most popular one I've been adding.
Yeah. Yeah, I love peels too. We have recently started doing a peel that we formulated for our own practice. It's called the Skin Bright Peel, and it's has tazarotene and
Hmm.
kojic acid, and it's been working really well.
Yeah, all
So
skin types too, right?
all skin
Yep.
types. And you know, with peels, depending on the prep, how much you apply, how many layers of the peel you apply, you can make it as superficial or as as deep as you want. So you can start off with a lighter version, and then subsequent treatments can go a little deeper. But yeah, dark skin is tricky. So if you've got dark skin, I think it's really important to see a dermatologist like yourself, and get a game plan
Yeah.
together, and not just, want to just go and do any treatment that you see online.
Unfortunately, dark skin is not as forgiving.
It's
That's
not as
that's the
forgiving.
thing. And I feel like if you're gonna go do a procedure and you have dark skin, always just take your time. Don't jump into something because you want a quick result. Because if you do get a complication, that's gonna just take so much longer to fix than actually the problem you had initially. So
Yeah, I love that. All right, so should we play a game?
I'm ready.
Slay or nay?
So okay.
I'm gonna have to wing it because I don't have anything written down for this, but okay. And we may have already covered some of this in our podcast, but let's start. Dermaplaning, slay or nay?
Slay.
Slay. Love
Mostly
that.
because it's really satisfying to watch. I
Yeah.
can't do it to be like my fiance will ask me, and I'm like, you don't want me doing this on you.
No.
Like,
What about at-home chemical peels?
nay,
Nay.
nay.
What could go wrong, Dr. T?
So many things.
So many things.
Especially now, you could buy. I think if you go on the internet, you can buy whatever you want.
You can buy
It's kind
whatever
of it's kind of
you
concerning.
want. So concerning.
I would not do a chemical peel at home.
What about Hyaluron pen? For those of you who may not know what Hyaluron pen is, it's something else you can buy on Amazon, and it's a needleless lip filler. Unbelievable that this exists, right? And it uses force, and I'm saying this in quotation marks, to put hyaluronic acid into your lips, right?
Yep.
How does that even work?
Honestly, you watch these videos, and one, it's very irregular, like
Yeah.
the amount of product. And then all you have to do to decide if you want to do it or not is just type in Hyaluron pen complications. Google it. You'll never want to buy that.
That's a great tip. Yeah, whatever you want to do at home, just Google it, but add complications at the end, and then you'll get your answer.
Exactly.
What about derma rollers?
You know, initially I was hesitant on this. I think nowadays they're getting the ones that are like one and done. So they're cleaner.
Disposable.
The disposable
Yeah.
ones. And they're now the stamping ones, which are kind of nice.
Yeah, those are better.
And I think it is okay to use. I don't tell people you're going to see dramatic result if anything, it's great for just drug delivery.
Yeah, that's true.
You know, if you have hair loss and you want to use minoxidil and or like a retinol with your minoxidil, using the stamping just helps penetration. But like if you have a deep acne scar, don't expect a miracle from a tiny little at-home derma roller.
Right. And you know, the theory behind that is little small micro injury to the skin initiates wound healing, which then produces collagen and elastin. So I agree. I think we've come a long way, you know, since the initial derma rollers that would get dull over time and had the potential to tear the skin. Just be sure that maybe it's good to have a conversation with your doctor before starting something like that. Okay, last one, threads. So we didn't really talk about threads, but what are your thoughts? What do you think of threads?
This is probably one we're going to disagree on, I think.
Okay.
Honestly, I don't like threads. So
Yeah.
it's a nay for me, or slay or nay, right? That's the game. Nay for me.
That's fair enough.
And the reason I don't like it is I think, one, they're overused.
Mm-hmm.
I think they're not used in the right patient. They don't last as long as they are marketed to last.
Mm-hmm.
And I know for some people, if you do it correctly, I think it's safe and it's okay. But obviously, we've seen the complications. They put it way too superficial. You have this barb coming out of your head. If you do it in the wrong plane, and then you have to do procedures down the road.
Yeah, infection,
Yeah.
you know, placing them if you've got some bacteria on the surface of your skin and they're not doing a really good prep before they insert it, you can get an infected thread. And yeah, a lot could go wrong. I agree. It's one of those things that, I mean, I do threads in my practice, but I'm so selective on who I choose this with. And, you know, there's different types of threads. There's the pulling and the barbed threads. And then there's one that you can just lay in the skin that stimulates collagen.
Which one do you use?
I use both, but I would say I definitely do the collagen stimulation one a lot more because not everyone qualifies for the barbed ones.
Yeah.
If you've had a lot of fillers, you've had a lot of Sculptra, it's really risky to insert that barbed thread because, you know, you've already got some scarring underneath the skin. So it's not going to be as predictable. If you've got thin skin, I would stay away from threads because you're asking for complications. And then, you know, if you've got really a lot of laxity, you know, surgery is going to be your better option. Why waste money on threads? So there's definitely some drawbacks and some, you know, some benefits to it. It's one of those things. Yeah, you have to have a discussion. Yeah. Well, thank you so much for being on the podcast today. It was so fun.
Thanks
I love having dermatologists on there because we can just totally geek out and have all kinds of conversation. And I love to hear people's viewpoint because we all do things a little bit differently. So if people wanted to find out more about you, how can they find you? How could they come in and see you? I know you're all over the place. You're active on Instagram and TikTok. And so give us the lowdown.
Well, you could find me on Instagram, TikTok, all these social platforms at Dr. Tomassian. You could find all the information for my clinic on my Instagram as well. We take basically all insurances and see a bunch of stuff for cosmetics. So if you're ever in the area and you need a dermatologist, come and see me.
All right. I love it. Thanks, guys, for tuning in.